take. I am not yet 40, but I'm very, very close to 40. And this is going to be a class that anyone can take this information, but I will make certain, suggestions if you are over the age of 40, literally 40 to 100, it doesn't matter. There are a ton of things that are specific to our ages, but any of the information that we talk about today can be applied no matter where you are in your health journey. So, my name is Abby Horton. I have the privilege and honor of teaching at the Capstone College of Nursing as an assistant professor. I am a registered nurse. I am a certified health and life coach. I have been a former Wellbeing ambassador for a number of years for the Honors College, and I am one of your wellness class educators. You can reach me at abby.horton@ua.edu if you'd like to give feedback or if you want more conversation or discussion, or you have questions, or you just think of something you'd like to share, please feel free to reach out to me. I love hearing from y'all. It's really a highlight of my week to be able to teach these Wellbeing classes. And so I'm excited to get to share with y'all today some of the common health concerns that people approaching 40 and over the age of 40 often have. And then we're going to discuss some of the important health screenings for individuals over the age of 40. We'll talk about useful strategies for effective weight loss and health management. And then we'll talk about how to stay fit after 40. So, again, anything that you're going to do can be impacted as you age when it comes to health related changes. And part of it is just your natural aging process, but also part of it is just life gets a little bit more complicated as you age. We'll talk about what it means to be in the sandwich generation where you may be caregiving for parents or older family members or even neighbors, kind of unofficially or officially, while you also may be caregiving for your own children or perhaps grandchildren. So, all of us are at different seasons of life, different ages and stages, but we all probably wear a lot of hats. And so, some health concerns that we can have as we approach 40 or just over can be things like chronic pain, arthritis. Back pain is really common. It's one of the most common pain complaints that we hear in the US. Tendinitis, generalized pain, just meaning pain all over the body, joint health, osteoporosis, stress, acute or chronic, depression or anxiety or other mental health challenges, heart health, which can be things like blood pressure being increased or elevated, cholesterol, having elevated triglycerides. We can have changes in our resting heart rate, which is a really big component in our cardiovascular health. If we have heart rate variability, inflammation, really what we're seeing in the literature is that inflammation is one of the common root causes for all chronic disease today. So if you want to pick one thing to really work on, I would say working on an anti-inflammatory lifestyle, not just a diet, but a lifestyle. And then communicable diseases, blood sugar can sometimes become increased. And then, of course, we look at body mass index. As we age, it can sometimes become difficult to lose weight. Then we've got things like skin cancers, other skin concerns, changes in our hearing acuity and visual acuity. We certainly have hormonal changes around this time of life, and then we can have sexual health challenges related to that, lifestyle changes, and mental health. So, really, everything that you can have in your health can be impacted. This is just a big laundry list of things, but we're going to do a deeper dive into some really common health concerns. So, Brene Brown is a social worker and expert when it comes to things like our mental health and just how we approach our lifestyle and habit change. And so, I think that midlife, at least for me personally, I'm 38, I'll be 39 in a few months. As I think about life after 40, I think it gives us a really important opportunity to pause and reflect and reset. It's really like the New Year's of midlife, where we can say, okay, what do I want this next half of my life to be like? Okay, so I don't want this to be like morose or morbid or anything like that, but I think when we face something head on, in terms of stressors, we can have a stress response where we run away, we flee our stressors, or where we fight our stressors. I kind of like the approach of where we just face our stressors as what they are. And that way, when we face them head on, we can know what we're dealing with and we can come up with an approach that feels good for us, that's in alignment with who we are and what we value. And so when someone tells me, "Do you want the truth?" I say, "Yes, I want the truth. Don't sugarcoat it." And I think that that's really what midlife is inviting for us, is just to say, okay, where am I on this journey of life? If we think about life as being a football game, you know, most of the weeks we can be really celebratory about that. Not so much this week, but when we think about life as a football game, we're kind of entering halftime. We're entering that intermission time, and we've got a couple of more quarters to go. So we've got a couple of quarters down, and we're kind of entering into our next quarters, right? And so we're at this halftime season of life. And so Dr. Brene Brown says, it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open up everything back up to heal the hurt. Midlife is not a crisis, midlife is an unraveling. And I love that approach because she has a very straightforward, no nonsense approach to anything that she's addressing when it comes to mental health and lifestyle behaviors. And so I really adopt her philosophy on that because when you look at the life expectancy that we have in the state of Alabama, women tend to live to be around 77, 78 years old, and men in Alabama tend to live to be around 76 or 77 years old. And that can be the really difficult thing when we look at midlife is we think, okay, by 38, we're about halfway done if we line up with those statistics. And so not everyone likes to talk about that, but it can be really helpful when you're thinking about what's important now. So, how do you win in the moment? It's an acronym. What's important now? And what's important now might look differently if you're facing a health crisis or if you're approaching midlife or if you're just past midlife. You can really put things in perspective when you think about the day to day challenges that we have and stressors that we have when we do have these bigger life events or when we do zoom out and look at the totality of kind of our life and our plan and where we're going, it makes every day a joy because we're not promised anything beyond today. We're not promised anything beyond this moment. And so if you look at it from a really positive side of things, it really lets you live in the moment and capture what you can capture now and enjoy the here and the now. And so I hope that that will be a nice reflection for you guys. I know that it can be difficult, especially as we age ourselves and as our loved ones age. I know for me personally, my parents are in their early to mid 70s. And so it's difficult for me to think about personally, that my parents are in those last years, potentially. And so, again, we can always beat the averages. We usually do in Alabama. We're pretty good about that. But it is good to kind of know, okay, on average, this is what the years that we can look forward to. And so, how can we make those the best years of our life? There's a longitudinal study out of Harvard that covered about 70 years. And in this study, they found that the people who had the longest longevity, so the people who lived the longest, who were also the happiest and who were also the healthiest, were the people who had the best forms of community and connection, and were the people who really prioritized important and healthy relationships. So, while we're going to be talking about screening and prevention and other keys to healthy living, I want you to know that some of the best things that you can do is to have a good community, a good connection to people, good relationships with others. Those are going to be some of the best determinants of whether or not you live a long, happy, healthy life. And I think that's really the goal. So these screenings and preventions are important. But they're not the end all be all. There are a lot of other things that you can also include. So while we all work to make better, healthier choices, we can do that within community. And I think that I love that the most about Wellbama is because Wellbama gives us this built-in community of like-minded people who are also working towards some of the same goals. So like Strive for 5 and Couch to 5K and the Move Spring app, those are all great examples of forming those connections. And so think about the opportunities that you have on campus to be able to connect with other people. So wellness screening, some of the things that we do there is we look at your heart health, we look at your cholesterol levels. So when you come to a health screening, you actually get your blood drawn. It's just a finger stick, very painless and very quick. And once you get that, you're going to be able to get your cholesterol numbers, your blood glucose numbers, so your blood sugar. We'll take your blood pressure. We'll also look at your triglycerides within that one blood draw, one blood stick. And then we'll be able to calculate your BMI by taking your weight and your height and your waist circumference. We'll talk to you about your personalized health risk and your activity levels, and you'll be paired with a fifth semester nursing student or a master's degree nutrition student, and they will do their health coaching with you based on your particular numbers and your risk factors by asking you a series of questions. And at the end of that health screening, you will receive a $50 gift card, which is such a nice bonus. And you're getting all this free information, plus you're getting your $50 Visa gift card, plus you're getting a nice t-shirt, and we even have apples at checkout. So lots of good things. And you're getting community because you're getting to, wait briefly in a line with other people who are there. And it's really fun. I get to see a lot of people around campus when I'm there with students. And so I feel like that's fun for you guys too. But that's a really great health screening opportunity that Wellbama offers through the Wellness and Work Life, and something that we want people to know about and to benefit from. I go to my regular doctor's office appointments, my annual visit, and yet I still do my health screening because I think it's always good to have extra numbers to be able to track trends, your blood pressure, your blood glucose numbers, your cholesterol numbers, and things. All of those are going to change and fluctuate throughout the year. And so it's nice to just get that extra bonus and to just take advantage of the benefits that you have here as an employee. So we would love for you to utilize that as a resource. We also think that it's important for you to have your regular annual physical exam. So your healthcare provider, that might be a physician's associate, it might be a medical doctor, it might be a nurse practitioner. We always recommend that you get your annual exam. A routine exam really should look for and screen for medical issues and track any and monitor any issues that you've had previously. Should be on the lookout for things that you have based on your health history, but also your family's history of health concerns, and be assessing you for your risk for future medical conditions, either based on your age of life, your stage of life, maybe particular risk factors that you have due to your work or your gender, anything that could be a determining factor. That can be a time to assess those risk factors. It's also a time to encourage a healthy lifestyle, to update any immunizations, any vaccines, and it helps you build a relationship with your healthcare provider. So that's what I really want to focus on because it's always, a little bit overlooked when we think about benefits of going to an annual physical exam. When you are in crisis or you're having a health condition or, you're going through a health scare, it's really important that the person that is providing care to you is someone that you know and have an established relationship with. And the best way to establish that relationship is by going to an annual appointment when you're not sick. It's very difficult when you're sick and when that physician or that nurse practitioner or that physician's associate, a PA, when they're trying to monitor you or counsel you or give you medical advice around a serious health concern, that's a really difficult time to establish a relationship with them and for them to know your baseline, to know what's normal for you. But if you've been going for regular physical exams over the years, then they have a better idea of what your baseline is, what your needs are, what your life is like, and they can make better and more personalized recommendations for you. So I definitely would encourage that for people who are healthy. You still might want to consider all of those different benefits to going for a regular exam. For me personally, and for my husband and I, that has been really helpful to us because things will be going great, and then we'll have, a health issue or a health scare come up. And knowing that our healthcare provider, our medical doctor, is someone that knows us well and knows our health history well and knows our family history well is such a time, of comfort for us because then we're not having to, wonder or guess, oh, well, are they going to understand how this impacts me? Or are they going to understand the challenges that I'm facing with this. And we don't have to wonder about that because we do have that established relationship. But it does take some time and some intentionality. So think about that as you make your plans for this new year. Think about adding your physical exam. Some other things that you might want to consult with your healthcare provider, things like making sure that your annual exam is done with lab work. So that's really important that your blood work is done so that they can look at your vitamins and your minerals and your electrolytes, your cholesterol, your blood sugar. These are going to be pretty standard, but there are other things like maybe your hormones or your thyroid. That you might need blood work for based on your age or your other risk factors. And so your medical provider would be the best person to personalize that lab work for you, but I always think that it's important to have a physical exam with lab work at least once a year. You want to take advantage of your dental exam and cleaning opportunities, so that is covered through Blue Cross Blue Shield with our plan twice a year, so every 6 months, and I really, really highly recommend that. Something that I also recommend, that something that I just recently did within the last few years, is switch to an electronic toothbrush. So, we cannot, as my dentist said, we cannot brush to the capacity that an electronic toothbrush can. There's no way the strongest of us, the most diligent of us, in terms of toothbrushers, cannot match the work that a battery powered electronic toothbrush can. So I highly recommend that everyone get an electronic toothbrush if you can afford that. It is an investment. You don't have to get the most expensive one because literally anything that's electronic is going to be better than what we can do by hand. And there's usually the Oral-B or the Philips Sonic. I like the Oral-B better with the round toothbrush head on there. That works best for me, but other people have preferences that they prefer the standard toothbrush. But I think that either one is probably a better choice than just straight manual brushing with a regular toothbrush. And those will come with a charger and with like additional heads that you can change out. And so you can change that, based on your doctor or dentist recommendation. But I think that's a really, really helpful thing. It really does help with cleaning teeth, especially for children or people who have issues like we call it manual dexterity, but anyone that has a difficult time brushing their teeth for some reason, maybe it's that they have weakness in their hands or a shoulder issue or whatever it is. That can be really helpful. Flossing is also really, really important for gum disease management. And starting at around age 35 or 40, having someone actually measure, perhaps a dental hygienist or the dentist, measure your gums to let you know if you have healthy gums, because there are some preventative things that they can do to encourage and to teach you about if you do start to have receding gum lines. I had never had that done, but I recently have a new dentist that's taking over my dentist who's retiring's practice. And they said, okay, we're going to measure your gums. And I said, I've never had that done before. And so the dental hygienist really went through and explained to me about that. And it was really, really helpful. So hearing screenings, y'all, I don't think we do this nearly enough. We do this in school, in elementary school. It's mandated that we have so many hearing screens by the time that we graduate K through 12 in Alabama. But typically, we don't do that unless there's a problem afterward. And so I would really recommend, particularly if you're always asking someone to repeat themselves, is that an environmental thing? Are you just kind of in a noisy location in a building, or are you distracted? It could be any of that. But also, it could be that you're having hearing related changes as we age. And this is partially determined by our hormones. So men tend to experience this more because of testosterone. So anyone that has testosterone, this could be something that is a consideration. But as we age, there are certain critical points where our hearing may progressively decline. And so for people who are at risk for that, it's important to know for men with testosterone, it's usually at birth, in the teen years, in the early 20s, at midlife, and then kind of in the elderly years. But I think that for anyone, especially people who work around loud noises or who've had challenges, to get a screen and make sure that your hearing acuity, your ability to hear is what it should be, or if you have some challenges. So I actually have 10% hearing loss in my left ear. And I've noticed that there are times where it's more difficult for me to hear people when there's background noise. And so sometimes it's that you don't have a hearing loss per se. You may have what's called auditory sensory issues where you may have challenges hearing when there's a lot of background noise or a lot of extra noise. So your hearing may be perfectly fine, but you could still legitimately have an issue with having mixed up sensory signals. And so I was actually able to go to UA Speech and Hearing and have a test done, and I spectacularly failed my screening for that. So I actually do have a problem with auditory processing with my ears, but I only have a 10% loss in my ears. So I have to literally turn the volume down on everything if someone's talking to me or if there's a lot going on. And I will tell people, make sure you call me Abby if you can't get my attention. A lot of times people will, call you like Dr. Horton, or they'll, say, hey, or, they won't say your name. And so I will say my name really loud and very, matter of fact, and that will get my attention the best if you can't reach out to me. So that's something that I told my students when I was in clinical and in really busy environments. I would have to make those kind of accommodations. And so if your hearing screen is perfect, which sometimes it is, and you're still having challenges, ask about that auditory test to see if that's maybe the issue for you. A lot of people struggle with it. It's not super uncommon. So, but just a lot of people don't know to ask. So every 10 years, I would say, after the age of 50, maybe up to every 3 years, you might want to start having a hearing screen. So, if, in your 20s, your 30s, your 40s, and then after 50, every 3 years, or as needed, your audiologist would let you know. And usually, an ear, nose, and throat doctor has an audiologist that can do that screening for you. And then, of course, we're very fortunate to have the UA Speech and Hearing. I actually have a son who has bilateral, so both ears sensory neural hearing loss. So it's an issue with his brain and his ears not really connecting. And so he has been at UA Speech and Hearing since he was 12 months old. And he is almost 14. And so those services are great. So people in the community can use those. Our UA community can use those. And it's for children and for adults. And so definitely check that out if that's something that you have questions about. They are located right across from the nursing building, and they have a great team over there. Can't say enough good things about them. Comprehensive eye exams with pupil dilation. So sometimes if we just need reading glasses or readers, we'll get them at the local pharmacy, or we'll go and see an optometrist and we'll just have them check our eyes with a Snellen chart. So the big E chart. Or sometimes, we'll have the electronic ones now, which I really like because you can't cheat that system, right? It knows if you're squinting, so it knows if you're trying to really, really strain to see that line, which I love. But I think it's really helpful, especially as we get older, or if we have any sort of risk factors for things like any kind of ocular issues, eye disease, glaucoma, high pressures, things like that, to have a pupil dilation with an optometrist. An ophthalmologist will be able to do a pupil dilation on you and make sure that your arteries and your vessels in your eye are healthy. And that's usually good to do every year. One thing that I would like to mention is that sometimes we think that once something has started to decline, that it's always going to be on decline. And so, our eyes are really affected by our overall health, and our eyes can tell a lot about our health. And so, a few years ago, I was really struggling to see. I was having a lot of blurry vision, and I was having a lot of eye strain, doing a lot of computer work, of course, which a lot of us do that here on campus, and dry eye was really an issue. And so, ophthalmologist recommended that I have a procedure to put in stents to help drain and help with the pressure because I was also having some higher pressure readings. And I have a strong family history of glaucoma, which is high ocular pressure. And so I said, well, let's just wait because nursing, we teach to do the least invasive thing, like the least painful thing first. I was like, let me just try to get some dry eyes, no tears, solution and start using that. And when I started addressing my inflammation, I noticed that all of the eye issues that I had had, although nothing else in my life changed, I didn't have those eye issues any longer. And then after I had a surgery that really impacted my inflammation for the better, after that surgery, my inflammation really started to clear up. I went back in for my eye exam about 4 months later, and my eyesight was better than 2020. Now, I have worn glasses since I was in the fourth grade. And so for my eyesight to improve to better than 2020 at the age of 37, 38 at the time, I just want to say that, our bodies are designed to heal themselves. So just because you've always struggled with something doesn't mean that you can't make changes. I was shocked. I had read the literature that said that that was possible to see improvements in your vision and in those other things that I mentioned. But that made me a believer. Seeing, literally seeing is a believing. And so just want to be encouraged that for anything I mentioned today, you have so much power to make a change. And it may take a while. Blood pressure screenings are important annually, cholesterol screenings, diabetes, so looking at your blood sugar, looking at your total cholesterol, but more important, looking at those individual numbers. Eventually, most doctors are going to have you do an annual baseline chest x-ray, and I can't tell you how important that is. That has been very, very important, particularly in our family, because this is not done often. But having a baseline is great, especially in our post-COVID years, because when we have things like pneumonia or COVID, or different things that impact our lungs, upper respiratory infections, that can leave scar tissue in our lungs. And so having a baseline chest x-ray that lets us know if there's scar tissue present can be really impactful as you start to age. When you're having other challenges with your health, then they can go back and look at these previous chest x-rays and compare to see if what they're seeing on this chest x-ray, this CT scan, this MRI is something that's new or if it's something that has been present before. So that's really helpful. And then checking your thyroid, very, very important. So lab values can be important to check, and they can do a complete thyroid panel if that's warranted, and your healthcare provider would be the best person to determine that. But also palpation, so actually feeling your thyroid. So taking your fingers, and this is not something that you would necessarily do at home, but something a provider would do in the office. So taking your fingers and actually touching your thyroid, there's a specific technique where you tilt your head and you swallow and you palpate one side and then the other. And so this is not a self-screening, but something that you would have a provider do in the office. And it's not always done by providers. So if that's something that you have an interest in, definitely ask if they are going to palpate your thyroid. But if you have any swelling, any tenderness on either side of the base of your throat, if you have a history of thyroid issues, or if you're having persistent fatigue and issues with weight gain or weight loss resistance or difficulty sleeping, those are the kinds of things that you see around your 40s and 50s with perimenopause, but also men go through a very similar thing. We just don't talk about it a lot. But it also can be related to thyroid health. So, thyroid and hormonal health go hand in hand. I have a story about each of these things. My family and I have really been through a lot of health issues, particularly my kids and my husband. So, I could give an example for everything, but the one I'll give about this thyroid health is that my husband's blood work looked great in terms of his thyroid panel. It looked great, but he had a lot of thyroid symptoms. And so, because he had diabetes diagnosed after a 3-year use of steroids for bone tumors, he was referred to an endocrinologist. And the endocrinologist was the first person to do a palpation of his thyroid. And when the endocrinologist did that, even though his blood work looked perfect, he was very symptomatic. And when he swallowed doing that palpation, he noted that there was a tenderness, and Chris said that, this is tender when you touch there. But then the physician was actually able to feel a nodule. And so they were able to schedule him for a biopsy, and he ended up having papillary thyroid cancer, which is very unusual. I mean, it's not a rare thyroid cancer, but every nodule that you palpate is not going to end up in that. Usually it's just swelling or inflammation. But that was the thing that was able to actually diagnose him early so that he could have a really good outcome and early treatment with it. And so, as much as, test and as much as, blood work and those kinds of things can be really, really helpful in diagnosing things early on, I really believe in the power of touch and the power of like laying eyes on a patient, laying eyes on the things that you're concerned about because blood work looked perfect for him, but yet he had this nodule, and it was caught early because the doctor really went to, the standard of care and did the clinical things that were important. And so always know about these things because, again, you know your body best. And if something has changed, then you're the expert on your body and you're the most important person on your healthcare team. And so you being able to advocate for yourself and to know what to expect can be really helpful in getting the care that you need. Immunizations, things like flu, tetanus, pneumococcal for your prevention of pneumonia, hepatitis as recommended, especially for healthcare workers. Those are all your regular immunizations. Of course, COVID and COVID boosters are important. Colorectal screenings, usually age 50, unless you're at a high risk, although they really have looked at maybe the age 45 range as being a better parameter for starting those testing. Colonoscopy usually is recommended every 10 years. And then things like having a fecal occult blood test, those are some tests that they can do to actually look at the health of your colon and at your bowel movements to make sure that you're not having any issues with your GI system. And so that can be important to screen for cancer risk, but also things like, ulcers and other challenges, other gut health issues that you may be detected. You also can look at having a mammogram or thermography. So women aged 50 to 74 are at an average risk for breast cancer. They should get a mammogram every 2 years, unless otherwise instructed by their physician. And then women who are 40 to 49 who are at a high risk will often be able to get an early mammogram. And so that's something that you might want to talk to your healthcare provider about. They have really started lowering the age to be closer to 40 because in the last 5 years or so, early onset of breast cancer in women who are in their 30s, even as late as their late 20s, has been on the rise. And so breast cancer is one that people are really looking at. And so some of these standards of care are lowering the minimum age for these tests to be able to make sure that we're screening people properly. And so if you do have a risk factor, that's something that you can talk to your healthcare provider about to see what's best. A lot of times they will do things like ultrasound or thermography instead of mammograms for younger women because younger women tend to have denser breast tissue. And the denser the breast tissue, meaning how close that breast tissue is together, can be really challenging sometimes for them to see things on a mammogram that would indicate that there needs to be further follow-ups and exploration. And so having things like an ultrasound might be beneficial. I actually had an enlarged lymph node on my left breast in my early 30s. And so I was monitored for 18 months. And luckily, it was an inflammatory infection based issue for me. But I learned a lot about breast health from that experience and a lot about lymph and the importance of lymph drainage because our lymph nodes don't have a circulatory system to be able to move the lymph around like the heart moves the blood around. So things like jumping on a trampoline or a rebounder, things like exercise and movement, jumping jacks, anything that's going to move your body and kind of give it that shaking motion, or even manual massage and tapping on certain points can be really, really helpful for your overall health. And that can impact things like your lymph nodes and enlargement and things like that. Now, if you do have enlarged lymph nodes, or if they're tender, or if you have some other, kind of, contraindicated risk factor, then definitely ask if those things are okay for you. Anyone who has a history of cancer or enlarged nodes or things like that will definitely want to ask before starting doing like manual lymph massage or rebounding because that can dislodge things that are in your system and you might not be in a healthy place to be able for your body to manage that. So definitely ask. But things like drinking more water also is really helpful in moving your lymph through. So prostate exam is another one that we like to have people know about. So age 50 for people who are at average risk, and then 45 men who are at a high risk, you may start actually having prostate exams, doing things like the manual exam, but also running the antigens to make sure that your prostate isn't having any kind of challenges or enlargement in that way. So there's some other criteria here. If you're at an even higher risk, people as young as age 40 might start having these exams, but things like nicotine, vape, tobacco products, those can all influence your risk factors, and even things like benign prostate hyperplasia, so where the prostate will actually enlarge, but it's not because of any kind of malignancy or pathology. Usually it's more of an inflammatory hereditary response, but it's good for that to be checked out because you never want to assume. Eating more fiber, drinking more water, trying to build muscle, and really working toward good bone health can be important. We always tell people, to drink milk, but really milk is not usually the best source of calcium to help with bone health. There are other like leafy greens and other nutritional, intake that you can do in eating good fruits and vegetables that can increase that. Beyond milk, a lot of times dairy can be inflammatory. I know that that can be a little controversial, but that's supported in the literature. And then people do have intolerances to it. So look at different sources of calcium for you. If you like milk and milk, you tolerate it fine, then go for it. But just know that there are other better, higher sources of calcium than milk. Some other screenings for women, an annual clinical breast exam where a practitioner actually will do your breast exam. Usually a gynecologist will do this at your annual GYN visit. A monthly self-breast exam. So for people who still have a menstrual cycle, it's best to do this after your cycle is over so that your breasts are not tender, because you are looking for tenderness when you're palpating your breast exam. There are a lot of different methods. So you can do this kind of lawnmower method where you're running your fingers all the way from the edge of your arm, like underneath your arm, where you're running your fingers up and down like a lawnmower would do in a very strategic way, covering all of the breast tissue, especially in this axilla area, like that underarm area. You can have breast cancer and enlarged nose out into that area, and so that's important to not miss. And then add in a circular motion, so where you start at the nipple line and you work your fingers out in a circular motion. Those two are really good methods to make sure that you are getting all of the breast tissue, and you don't want to lift your fingers off. So you're going to use the finger pads of your first 2 or 3 fingers, and you're going to just lightly move those fingers around. But see how I'm lifting off? When you're lifting off, you could miss something because usually these areas are small. So when you're doing it, you want to make sure that your fingers stay in contact with your skin so that you're seeing and you're feeling everything, and you're not missing something because you've taken your hand off and you've placed it. For mammograms, of course, those get scheduled through usually a hospital or a local breast care center. So that's something that you can reach out. Typically, at age 40, they will start entertaining the idea of scheduling that for you. Of course, a pelvic exam and a pap smear test are usually done. Pelvic exam usually yearly. Pap smears, if you have had good readings and you've not had anything occur in the last usually 1 to 3 years. You can go as far out as 3 years now, but again, your healthcare provider will determine that. So either annually or every 3 years if you have a good track record with not having those pap smears be a concern. And then bone density test. There are a lot of different scans you can do for this and different tests. You can look at blood work, but you can also do something called a DEXA scan that looks basically like takes a picture of your bones and measures the density of them. And then you have additional screenings for men over 40. Of course, the annual testicular exam, that's usually done with a urologist. And then the monthly self-testicular exam. For men, usually we tell them to pick like their birth date. So if you're born on the 12th of the month, then the 12th of the month, that's just when you do your self-exam. And so that's really important, to make sure that they're palpating, to make sure that there's no masses or tenderness, or anything that feels unusual, that there's not enlargement. Those are some of the signs. that you would look for the self-testicular exam. And then the prostate screening, this is doing the PSA, the antigen test, but also then actually the manual exam. And typically a urologist is going to do that as well. So those are a few more details. Lots of details on these slides. So 10 healthy habits. By the time you're 40, I think it's important that you've already established preventative health care, that you maintain a positive attitude because there's so much that we could get upset about when it comes to our health. If we let it, we start to have aches and pains and different things that we just are feeling a little discouraged about. Our sleep habits can change. We, can have more difficulty getting to or staying asleep. Exercise sometimes can be difficult. And so having a good sleep and exercise routine is important. Scheduling that in your day, eating more healthy foods, drinking more water, eliminating the sugar and the calories in water, non-water beverages, getting your finances in order, maintaining an active, healthy lifestyle. Sexual health is a part of that. Really, this is confronting vices, but really anything that just doesn't serve you well. Sometimes things aren't a vice as much as it's just not serving you in this season of life. And then starting to really look at meditation and mindfulness can be helpful. So that's there for your review. Some hormonal changes that can happen for women. A lot of conversation is happening around perimenopause. So premenopause is just everyone who's nowhere close to being in menopause. Perimenopause, peri means around. So that means that you're around the time of when you would start menopause. Then there's menopause and then there's postmenopause. So the years after you've gone through a lot of those hormonal changes and fluctuations. And so perimenopause can happen as young as your 20s. You can have different things that happen that cause that. But we're seeing women in their late 30s and early 40s even going into perimenopause without other concerning health challenges. And so that's young. Usually that doesn't happen for people in the US until they're in their 45 to 55-year-old range, with the average being around 51. But globally, it's later into the 50s and 60s. And so women tend to, in the US, go through menopause earlier. Some of the symptoms are things like hot flashes, vaginal dryness, mood swings, frustration can be a big one, decreased libido, decreased concentration, insomnia, hair loss, particularly having like scalp inflammation, weight gain, and then things like having metabolic syndrome, which is the risk of cardiovascular disease or CVD, stroke, blood clots, type 2 diabetes, etc. So I actually asked when I went for my GYN appointment this summer, I said, I feel like I could check most of the boxes on this perimenopause, menopause box. And I had a hysterectomy 11 years ago. And sometimes that will cause you to go into early onset menopause. And so I get levels checked pretty frequently, but I said, could you just run a panel and see how my hormones are doing? Because I feel like I'm struggling with this a little bit. And it turns out I did have some abnormalities, but I'm not truly in menopause now. So I'm still hanging out in the perimenopause phase. But the thing that is challenging about menopause is that literally these symptoms can collide and can overlap with so many other things like stress or lack of sleep or just having some poor habits. And so it definitely is important for you to keep a check on it, but blood work is always a good idea to double check and see because hormone replacement therapy might be helpful for you. Hormonal changes for men, again, we don't talk about this a lot, but testosterone levels tend to start dropping 1 to 3% every year beginning at age 40. And so I actually had a physician who told me when talking about my husband's health is that a lot of times that, people talk about the stereotypical midlife crisis at age 40. He said for both men and women, it's not necessarily that there's a midlife crisis, it's that there's a lot of extra added responsibilities on your plate. And also, you're having a lot of hormonal changes. It's almost like you're going through adolescence again, but it's the adult years of adolescence. And so sometimes a midlife crisis really looks like you struggling to manage hormonal changes that we're not really prepared for. So I hope that this talk really starts to spark that conversation for you because it's something that we don't pay enough attention to. So decreased libido, hair loss, fatigue, mood changes, loss of muscle mass, increased body fat, especially around the abdominal area for men and for women, decreased bone mass, memory issues are huge for men who have low testosterone, lack of motivation or even depressive like behaviors and symptoms. You can have an increase in blood sugar sugar, and anemia. So anyone who has anemia and they're male and they're not having active blood loss, of course, that's the first thing you check for. But then the next thing that I'm going to automatically think is, I wonder if their testosterone is low, because it's pretty unusual for men to have anemia unless they have a condition like a genetic based condition or blood loss that causes that. That's not typical for men. So usually it's related to low testosterone. And then you can have seminal fluid changes, and so low volume and low count, and then also erectile dysfunction. And that goes hand in hand with blood pressure changes as well. So, why things can be so difficult in your 40s? It's all the things we've mentioned. You can have issues with your digestive ability, your decreased metabolism. These are not guarantees, but these are things that can happen. Decreased growth of the cells. So, the cells are going to not be typically repairing as quickly as they did in your 20s and 30s and before. And so, when you do have a challenge or inflammation, your body may be repairing and recovering a little bit slower. Lifestyle changes, again, we talked about those added responsibilities in work and in life. And then you can start to have weight loss resistance, again, because of those changes and because of inflammation. So, weight loss over the age of 40 can be a little bit challenging, but I think it's important that you explore what works for you. There are a million and one ways to lose weight and to manage a healthy weight, but it only matters what works for you, and that's going to vary widely. So, this is the BMI scale chart for you. Again, the BMI is just a metric, it's not the end all be all. It's definitely flawed in the sense that it was based on European Caucasian males who are healthy in their, healthy 30 to 40-year-old range, more than 100 years ago. And so, but it is a good metric for you to be aware of. It's just not the gold standard, in my opinion. And many people share that. So just let that be a metric for you. I still look at my BMI. I still strive for healthy BMI. It's important to me. But again, there needs to be some consideration for the fact that it is not the only metric for health and wellness. So, wellness basics, we have an entire class on this. I always tell people to start with hydration because it's the easiest thing that you can control. So, drinking about half of your body weight in ounces a day. So, if you weigh 200 pounds, drinking around 100 ounces. A bare minimum is usually 64 ounces of water that you need, because we have so much of our body, over 70 to 80% of our body is water. So, we need more water than we typically consume, but usually not more than 128 ounces or a gallon of water, because you can drink too much water and get water toxicity. So start with hydration, and then your food, control the things that you eat. Let treats be treats, right? And then really strive for a lot of vegetables that can be really helpful, and complex carbohydrates that are not going to break down into simple sugars and make it difficult. So really eat the rainbow. That's the way to get the best nutrition. Eat all of the colors, not just beige and brown and green. Move your body, do some mindfulness. Mindfulness can be closing your eyes for 5 minutes. Mindfulness can be listening to nature sounds on Spotify or a podcast. It could just be listening to music. It doesn't have to be the meditation that you would typically think about, but just giving your brain a break a few times a day can be really helpful. Start with 5 minutes and work up to 15, 3 times a day is really my prescription for mindfulness and meditation. And then work on sleep, because if you're stressed out, you're not eating well, you're not sleeping well, you're not, drinking what you need to drink, you're not moving your body, you're not meditating, then sleep is going to be the hardest thing for you to change. So it's the first thing because it's foundational for rest and recovery and repairing your body, but it's also the hardest thing to change. So, overcoming your weight management issues, I think there's a lot that you can do. Again, I think it's going to come down to what works best for you. And starting with the wellness basics is really the start of managing your weight and your health. So, there's some things here for you. I've listed a lot of sources here just so that you can do a deeper dive if you're interested. So, I'm going to go through these as more of kind of resources for you to come back to later, a little toolkit for you. So, again, management of your weight is going to be about the fuller you are, meaning the more that you eat of the good things and drinking the water, the less room there's going to be for things like empty calories and my favorite, Chick-fil-A Cokes and things like that. So add in the good stuff into your life. Focus on adding in the good stuff, and then you're going to have less room and time for the things that aren't as healthy for you. Working out is really important. I think it's important to lift weights. I think it's important to do cardio. Doing it the first bit in the morning can be really helpful for some people, but if you can't do that, exercising right after work is really helpful. You just don't want to wait until it's really close to bedtime so that you're getting your body out of its natural rhythm. But getting exercise in, even if it's just movement or a light walk after dinner, adding in those little things will be huge over the long run. Inconsistent, big things are not going to move the needle forward on your health as much as consistent small steps will. So, build in a couple of walks, walk in the morning, a walk before you go to work, a walk after dinner. That can be really helpful in regulating your blood sugar. A 10-minute walk after eating does a number of healthy things in terms of your body being able to use that blood sugar well. So here's some more reasons to get up and walk. We all know to walk, it's just hard to fit it in our more sedentary lives. Set a timer, get up and walk every hour. Refill your water bottle, go to the restroom, say hey to a coworker, but every hour get up for 5 minutes. That's my challenge for you today. Think about things for fitness. There are a ton of great resources on campus, the UA Rec Center, a lot of classes that Wellness Work Life has added on fitness and movement. So check those out. I always think that walking and swimming are the two best forms of cardio exercise, but weightlifting is going to be something that I always think people need to do, particularly as we age. It helps maintain our longevity and build that muscle and that bone strength. Here's some other tips for staying fit. But again, just make small incremental baby steps. Here's a 40 after 40 healthy habits. But my favorite is number 40. Remember that the best is yet to come. Sometimes we can get kind of stuck in the mundane of things in life and think that their best years are behind us. But my favorite thing to say is that the best is yet to come. And I really believe that. I think that we create our reality most of the time. Sometimes things happen to us, but I think we have the power to change our reality. And so the best is going to be yet to come in my life because I want to think that the best years are ahead of me, not behind me. And I bet y'all probably feel the same. So this is the sandwich generation. This is talking about how you're caregiving for people. Maybe you're caregiving for elderly, family members or parents, and then maybe children and grandchildren, and you're also doing a lot at work. And so this is just to acknowledge that if you're in that in between, taking time for yourself is really important. Self-care is not selfish, and self-care is not spa days and bath bombs and chocolate or playing golf or grabbing drinks with your friends. Those are fun social things to do. They're good self-care things to do in terms of like taking care of your external body. But self-care is really about soul care, and it's about being able to do the things that you need to do to manage your life well. Pain management can be really important, so making sure that you know your limits when it comes to pain management. If you do have pain management issues, definitely talk to a healthcare provider and identifying why. I'm a big fan of physical therapy and chiropractic care to help manage pain over things like taking pharmaceuticals. There's some things on how you can manage inflammation, things like the food choices, so eliminating gluten and dairy. Leaky gut can be things like not eating overly processed foods, going to cleaner products so that you're not having a lot of toxic chemicals, managing any like long-term underlying infections, and then of course managing stress, which is always easier said than done. Some things about your eye health. So again, some things that you can kind of create a little checklist. Things about sun exposure. It's very important that you check your skin using the ABCDE method. So I'll go to that next. So looking at your moles and seeing, are they asymmetrical? Is the border uneven? Has the color changed, or is the color different on the edges versus the middle? Is it bigger than it was before, or is it bigger than a pencil eraser? Has it changed in size or elevation? Those are all things that you might want to bring up to your healthcare provider or a dermatologist. I always recommend a yearly skin check with a dermatologist starting around this age, especially if you have risk factors. Or, some people will add in the ABCDEF, which F is the funny looking. Maybe it just looks funny. It looks different. Always ask about it because, again, you know your body best. I know we're getting to time, but I'm going to stay and finish up. If you need to go, definitely go. Um, I ran a little over time today, so sorry about that, guys. 1 out of 3 people are at risk for getting shingles at some point in their life, especially after you get to age 50 and beyond. even if you had chickenpox. And so stress can induce that. So make sure that you are aware of your options for a shingles vaccination. And this is what shingles looks like. It's usually on the upper back and under the rib area. So, for those of you who wear like a sports bra or things, for the ladies on the call, that's usually around that bra line in the front and the back, and it's a painful red rash. It almost looks like you have a little skin abrasion. And so that's usually the first sign. So don't let people touch it because it's contagious. But if you see that, go immediately to your healthcare provider and they can take care of you, give you some good lotions and medicines to help treat you. Of course, mental health is always important at every age and stage. And if you just feel like you are overwhelmed or not yourself and struggling to cope, it's definitely important to reach out. And sometimes that's reaching out to the next person so that they can help you get help. We have lots of great resources through our benefits here on campus, in the community, and through our behavioral health online. So definitely know about those resources. Usually, you have five free visits without a copay for any new life change or stressor, and you just go through an approval process by calling a phone number. So, super easy to do. Habit change, slow progress is still progress. So, just take one thing to do to make a change in your health. Here are some recommended webinars that you might want to go back and listen to on our wellness page. They're under the archived webinar talks. And then we would love for you to follow us on our social media. And I did, I wrapped it up in time, but I will switch over so I can see if y'all have any questions, comments, feedback, anything that y'all would like